Madam Secretary, welcome.
Thank you.
Senator Aram, you want a question now, or you want to hear from the Secretary first?
I'd like to hear first.
Okay.
Thank you, Senator.
Welcome,
Thank
Madam
you so
Secretary.
much. Marketa Garner Walters for the Department of Children and Family Services. We have given you a handout, and I am not going to go through every slide, but I will hit high points along the way. First of all, I do feel like this is a catch-up because it feels like a while since we've actually been able to see you face-to-face. Even though we had a session last year, it certainly felt a little discombobulated. So our doors closed for just a minute, but DCFS was the first agency to go totally remote because we had gone to laptops instead of desktops the year before. Our doors were never closed. We never skipped a beat. We were always at work and have been throughout this pandemic. It was a year of unprecedented need. I don't need to tell you what it's been like for our state and our nation and our world as we have addressed this COVID nightmare that has taken over our life. But if you think about doing human services in a way where you can't connect with humans, DCFS has done some remarkable spinning on a dime and figuring out how to rework to do our programs. And I want to just publicly thank, and I'll try not to cry, the men and women of DCFS because they have been true warriors in this work. How you do a child abuse investigation in the first place has always been something that has scared me, and because we ask our staff to walk in a door that they have no idea what's behind that door, and to add the layer of COVID on top of that was really truly putting our people in harm's way in a way we had never done it before, and they kept doing it and they didn't complain. And so and as we did the disaster response that I'll talk about in a minute, our staff have literally been on the front line, still face-to-face with a lot of people in a time when most people were behind closed doors and protected, and our staff weren't. We have had more people needing food in 2020 than we have ever had, and the numbers are staggering. The emergency preparedness role that DCFS plays, most of you by now know what we do in a disaster. At the height of, so COVID was a disaster by itself, but then when you had the series of hurricanes that hit us, and then the winter storm, at the height of our emergency preparedness efforts, over 1/3 of our staff left their regular job and did emergency preparedness work. 1,545 people were doing emergency preparedness work, and we were all over the state. We were in 3 different isolation sites for COVID when the pandemic began, for those people that had nowhere to go to isolate away from their home, whether they were homeless or they were a younger person that had an elderly person in their home they were trying to not expose, or whether they were an elderly person that didn't want to be with their children and grandchildren in an intergenerational setting. We set up isolation sites in the state parks, and that was DCFS staff 24 hours a day on site working with those clients as they came in and stayed there and quarantined for that period. We still are running 1 isolation site from the pandemic. So we are still in emergency preparedness, just in isolation. We were also at the medical monitoring station in the Morial Convention Center, setting that up. Now, when I say that, we're in partnership with LDH because they have the doctors and the nurses and the medical techs that are there. But the people that are doing the data, that are registering the clients, that are making sure the food gets to them, that are making sure they have telephones and a way to communicate because we're isolated and aren't talking, that's DCFS staff. So they leave their day job. These aren't we have a few emergency preparedness staff, but I mean a few. There's like 9 of them. And so these are people that leave their child support job or their SNAP job or their child welfare job, and they put on a different hat and they go to work in a different way. We enter into the incident command structure and we work 12-hour shifts. We're always surprised when our sister agencies are asked to come help us and they don't want to work a 12-hour shift, because that's what we do. We work 12-hour shifts. And so we had people at medical monitoring, and then as soon as disaster season hit, on top of COVID, we had to learn a new way to shelter, because congregate shelters in a COVID environment weren't possible to do. So we learned new language. And we have non-congregate shelters, which are hotel rooms. And so you will see on page 3 that we had almost 20,000 people that sheltered because of the multitude of hurricanes that hit us in about 108 hotels across the state in all of this time. Each one of those hotels had a team of 5 to 10, depending on how many people were in the hotel, of DCFS staff 24 hours a day, because most of the crises happen at night in the hotels. They don't happen at 2 o'clock in the afternoon. They happen at 2 o'clock in the morning. And so our staff were there, and we also had hotels in Texas that we didn't have staff in, but that we sent staff over to make sure that we were communicating adequately, getting the right numbers, because, of course, the Texas system didn't match our system and the way we track numbers. We had a total of 641 COVID patients in the 3 isolated sites that we had there, and they were in, as I said, state parks. So you had Lake Vistano in the north, Chico State Park over in the Lafayette area, and then Bayou Signet down in the New Orleans area. And I want to just tell you one quick story. We had a homeless man who was in one of our shelters, and the staff noticed on his form that his birthday was going to happen while he was in isolation. So the staff went and got a little cupcake and put a candle in it and put it on this front door and knocked on the door and ran behind, and then they all stood out there with a little cupcake with a candle, and they sang him happy birthday. He was 71. He had never had a birthday party in his life until the DCFS staff noted it and changed that. So we serve people. We are in the human services business, and that's what we do. And we are still doing it because the need is still great, and the efforts are still ongoing, not only in disaster management and certainly in COVID, but you know the numbers about our poverty rates. You know where we rank in all the national rankings. Members, we have managed and submitted and processed $686 million in food assistance in 2020 during this COVID emergency. There are almost 1 million Louisianians on food stamps right now. This has never been true in our state. And this is the compounding of people losing their jobs because of COVID, of people losing 1 of 2 of their jobs because of COVID, because of the isolation, and just because of the disasters that have hit our state. We've never had this kind of management, and this was all done with no staff increase. And so we don't really expect this to change over the rest of this fiscal year. The federal benefits that are coming in have been wonderful because they've been giving people food. In the first 30 days of the pandemic, we did 5 times the normal SNAP applications in the first 30 days. We were working around the clock, literally trying to process the application so people could eat, because in Louisiana we celebrate food, right? I mean, that is one of the things about us that every tourist in the world that comes to Louisiana can't believe the food. Well, we want to feed our people, but it takes a lot of work. And remember, the people that work the food stamp applications are usually the people doing the sheltering in the non-congregate shelters, because we try not to pull the child welfare workers away from what they're doing, because we don't want kids to be left in abusive situations. And so in our agency, we partner really, really well. We are one DCFS, and we hold hands very tightly. So we try not to pull on the part of the agency that serves the most fragile children. So then we were at this place where we're trying to serve the same food stamp staff that normally would be doing shelter duty are now looking at 5 times the normal applications. And it was really hard to keep up, really hard to keep up. So I just really, again, salute the men and women of this agency and what they've done. The data is there. I'm not going to go through it all. We had a new thing this year called pandemic EBT. So these were federal dollars that came in for kids that were normally in school, that aren't in school because they're homeschooling because of COVID, who were eating lunch at school on free and reduced lunch. So now they're home and those parents don't have the money to feed those kids. So the feds came up with this pandemic program and it was, exactly how much you pay for a lunch at school is what you're going to get put on an EBT card where you can go and buy food to feed your kids. So the formula was all done. It was 100% federal. That program had never been done before, and of course, systems don't talk to systems. So the DCFS system and our food stamp system didn't talk to the Department of Education system, which had all the data about the kids in the schools. And the Department of Education didn't have all the data because the data is kept at the local school district and isn't given to the Department of Education. So it was a massive undertaking to try to run this PEBT program. We are still working with them to provide these benefits in the current school year, so we got it all taken care of for last year, because COVID is stretched over 2 school years now. So we're still working with the schools now, and we are very anxious, to get that program totally operational and out of as much of a hand manual count as some of what we've had to do because of all the system interfaces or lack thereof. We did something incredible that nobody in the nation has ever done, and I want you to really hear this. Think about a DSNAP. Remember the old, Senator Barrow, I know you know, because we drove around looking for sites, the old Walmart, empty Circle K or Kmart store where we would come in with cables and tables and IT staff and line up people out in long lines in parking lots and have fans and tents and bottled water trying to get people through the food stamp line to get their disaster food stamp. COVID. You can't line up people in lines. You can't sit side by side and wait in long lines and be in these huge buildings. So we did DSNAP virtually. First place in the nation. And we're not done because we start Monday with our 7th DSNAP of this season from the winter weather storms. So if you imagine, this is hard for me to make words to fit what this looked like because nobody had ever done this. So we were making it up as we go, and I remember being at the UCG with our new Assistant Secretary, Shavonna Howard, that some of you got to meet. And we were talking to the governor about what this was going to look like. And the head of the National Guard and the head of the state police were there in the conversation because when we do a DSNAP, we have National Guard and state police, right? And they're looking at me like I'm nuts, and they're going, wait a minute, where are we going to be? I'm going, we're not going to use you. And they're thrilled because they're pretty busy doing COVID response and, all of the things that they were being charged to do. And so at the height in Laura, we did, we had 900 operators. So we took all of our SNAP staff, put them on phones in their own homes, figured out, and it's a mystery to me how this all worked, but it worked great because the operators could see who, the supervisors are watching, they can tell who's on the line, how long they're talking, they can see if a call is going too long, and they can listen into the call to hear what the problem is and why it's taken so long, because they know about how long it should take. The feds can listen in because they're set up to listen. The fraud people are there. The supervisors are there. And so we've knocked out where they're getting the, had a lot of hang-ups in the very first part when we said this is being recorded. And so any of those people that were just thinking maybe they might get DSNAP and didn't really have the, didn't need to, kind of hung up at that point. So it was a magical mystery tour is all I can say, but it was a phenomenal operation. And we will do it again starting Monday. It won't take as many staff to run this one because it's only 23 parishes. But we did it over and over and over. Every state in the union that has to do disasters is calling us, asking us how we did it. We have written the playbook. If we were in normal days, our staff would be traveling everywhere, teaching other states how to do it. Instead, we're doing Zoom calls, right? Because we're all so familiar with that. But the money we saved, I want you to hear this because I don't usually come talk to you about how much money we're saving, so I want credit here, okay? Because we saved $3 million in the Laura operation, which was the most expensive operation because we had to front load all the phone expenses. So what we're saving in Delta and Zeta and the winter storms is probably twice that. So money on the table that DCFS didn't take. So I want credit now because you know I'm going to ask for something. So I just want credit there. There's more data here about DSNAPs. And then remember, there's like 4 different kinds of SNAP money that can come in. So you get the regular SNAP benefit. Then if you lose power or in a disaster, if you're already on SNAP, you can get replacement benefits. Then there's a thing called supplemental benefits that not everybody that gets SNAP gets the full allotment. They get a portion of it depending on who lives in their house and how old they are and how much food they're going to eat. I don't know how the feds figure that out, but they got a ratio. So in all of the pandemic response, the Food and Nutrition Services said give everybody up to the maximum. Let's give people everything we can. Well, every time they do that, that's a change in our system that we have to go in and code and change. And so that's a lot of work for the staff. So you have the regular SNAP, the supplemental SNAP, you have the replacement SNAP, and then you have the disaster SNAP when we're responding to benefits or to disasters. So trying to communicate all of that to the general public was a massive undertaking. Our emails for assistance more than tripled. Our monthly calls to our call center more than doubled. And our website use went up 300% from March to December because people were hungry for information about how does this affect me? Can I get money? Can my mother get money? Where can I get the SNAP information? Do I have to go wait in line somewhere? People in Louisiana are used to DSNAP, and so they wanted to know where to go. And trying to explain to them what virtual DSNAP was took a little bit of time. And so we were really, I don't know how our communications team did it, but they were amazing. Child support staff had a whole different way of operating now because you couldn't be out on the road collecting child support. So we weren't meeting our paternity establishments because courts were closed. And so there were a lot of case delays. So there's a reduction in the amount of child support that we normally collect. Also, not just because we're not out there, but because our non-custodial parents lost their jobs. And so the feds and the states agreed we weren't going after people that couldn't work to try to enforce their child support orders. So that was all halted, and cases were not being held in contempt because it wasn't their fault that a global pandemic took their job. But it dropped our collections from about 54%. The arrears climbed because we weren't out there, and even some of the people working that had the ability to pay, since we weren't out there knocking on their door, they just kind of didn't. So the arrears climbed, and we are working to get back into that rhythm. And I want to say this the right way, and I hope I have the right language. In one way, it was almost good for us that that was happening because we were able to use those child support staff to do all the sheltering work. And had they been doing their normal body of work, I don't know how we would have managed all the shelters because we were so busy with the SNAP workers doing all this food response that the burden of sheltering really fell on the child support staff and some extra child welfare staff. So the federal assistance, I know everybody is concerned about all this money coming in from all the new federal dollars that are coming into the state. So we got money in the Consolidated Act that passed in December, the Consolidated Appropriation for SNAP and PEBT. And then the Pandemic Emergency Assistance that's there on the bottom of page 10 is from the American Rescue Plan. These monies are coming to us with very specific rules about how we can spend them. Some of them are a little broader defined, some of them are very narrow. We are literally getting guidance every day from our federal partners about how we can spend and what we can do. So we are still learning all of the ins and outs of that. I want to shift to child welfare and talk about what happened there. For those of you that have ever been in UCG with me, you know I always open my report with the state of the children because that is who we are and what we do and who we're responsible for. When a disaster hits, those foster children are still Louisiana's children and they're still in our care. And so if I want to know where my son and daughter are at night in a disaster, I also want to know where my foster kids are. So we had 234 foster children who were close contacts and had to quarantine. We had another 117 that tested positive. We had 10 foster children that actually had COVID and were in the hospital, but thankfully no children died from COVID. In our foster parent population, we had 217 foster parents that had to quarantine or were close contact. We had 132 foster parents that had that were positive. We had 13 of them that were in the hospital, and unfortunately, we lost 3 of our foster parents due to COVID. And I will never forget the very, very early days of COVID when our first foster parent got COVID, and her daughter called to tell us, and she said, my mom is sick, she has COVID, but don't worry about the kids, they're coming to my house with me. So y'all don't come get them, they're mine, they're coming with me. And so our foster parents stood up in miraculous ways with all of these kids that we had. Not one single foster parent called and said, please come get this kid, I can't handle it. I can't manage COVID and a child. Every single one of them said, they're staying with us, we're quarantining together, and we're going to do this because these are our kids. So our foster parents were amazing. They are amazing and have been throughout this. We had to learn how to do child welfare differently during the pandemic, just like we had to learn how to do other things differently. Our staff remained on call 24/7. The numbers of child abuse reports went down because teachers are our main reporters. They're our earliest reporters. They report the abuse and neglect because they see it first. They notice the child that's coming to school dressed inappropriately or that's wiggling around and can't sit still because their bottoms are sore from being whipped. They notice that they are sleeping and not paying attention. So our teachers are the front line of defense, and they weren't in schools, so they weren't seeing it. So by time law enforcement and the medical staff, who are our next line of reporters, started seeing it, the cases were worse and had gone further before we ever got the call and the report. So although the numbers have dropped during this season, the work didn't lessen for the staff, because we also had staff that were responding to COVID themselves and trying to learn to do the job in a different way. So we were using the child abuse investigators that weren't out doing as many investigations because the reports were down, and they were helping managing foster kids. They kind of shifted their caseload and helped the foster care workers manage these big caseloads, because I've been telling you for years we have big caseloads. They were harder to manage during COVID because it takes more energy to try to suss out on a Zoom call what a child really looks like. If you think about all the Zoom calls that you have done and the energy it takes you to focus and to attend and to look and to pay attention and to try to read body language and try to interpret what somebody feels like that you don't get face to face, the same thing is happening in child welfare. But in this case, it's not for us. There's lives at stake or health at stake, and so we've still got to talk to foster parents and talk to birth parents and talk to the kids and see the kids, make them take their shirt off and turn around so we can look at Zoom and make sure that there are no marks or no bruises. It's hard to build trust with a kid over a Zoom call, and so it was a different way of doing work. This mirrored what was happening across the nation. All child welfare systems were going through the same thing. So it wasn't just Louisiana, it was happening to all of us. And so we were sharing everything that we could with our sister states, trying to figure out, did somebody build a better wheel that we could copy? The protocols, we had to work with the judges because of course the courts closed. So how do you go to court? How do you do a foster hearing with the judge? How do you do adoption when you've been waiting all this time? And Senator Johns knows it's hard to adopt. It takes a long time. We want to make sure this is the right placement and the best forever home for that kid. And so when your time comes up and you're finally ready to get that final adoption and court's closed, you don't want court to be closed. You're ready for this kid to have your name and be yours. And so our judges had to figure out how to do adoption by Zoom and virtual courts, and they did, and they were remarkable, and we have some beautiful stories about what happened with that. We created Dr. Hodnett and her team did an amazing job, and I'd love for her to tell you stories when you have time. We did a 24-hour, 7-day-a-week hotline for foster parents. That was just because we knew that COVID was adding a stress that, and they might want to talk to somebody that normally they wouldn't have called a worker in the middle of the night, but now they really needed that support. We also created a 24/7 practice support team for our own staff because we're learning, we're driving this plane while we're building it kind of thing. And so staff would be worried that maybe they weren't doing it right, and they would want to talk to a supervisor or another worker to say, this is what I'm seeing on the call. I don't know. Is that right? What question do I ask? So we had a 24-hour support team that they could call and be able to talk. And another thing that happened that was wonderful, and I'll talk about this more in a minute, but when we decided, when it was thrust upon us to be virtual, not all of our foster parents and foster kids and birth parents have cell phones or mobile devices where they could do Zoom. So we got telephones to everybody. to all our teenagers. Of course, now they want to keep them and they love them, right? Because we gave them a phone, so they're real excited about that. But we wanted them to be able to call their sibling, because now you're not doing a sibling visit. Now you're not seeing your mom every month. You're not getting that night out with your family because it's COVID and you're isolated. So we got telephones or iPads or some kind of mobile device for every birth parent, every foster parent, every teen in foster care, so that they could talk to their siblings and their parents. And they love, and I heard juvenile justice, I heard Beth say a lot of the technology that we got, we've really appreciated and enjoyed, and our teenagers sure aren't giving those phones back. They're very clear about that. But they love being able to call and talk anytime. And so that was something that we've learned. Another thing that happened was the extended foster care program. The feds said you can't kick a kid out now because during COVID. So if they turn 18, or in our case 21, because we raised the age, right, Senator Barrow? So we raised the age. But if they turn 22, you can't kick them out during COVID. So we didn't know when we raised the age how many of these youth would stay in this program. We have been astonished at the participation. In fiscal year 19, when we raised the age, we had 67 kids in the program. We have 271 that we have served, and we have about 219 that are in right now. So the kids like the program. They like the support. They've left and come back. Now, our goal will always be to get them a permanent family before they ever get that old. So I won't say that the growing number is great, because I'd rather we had found them a family. And I am thrilled that they aren't out on the street and homeless, because they are allowed to stay in this program and get the casework and the support that they have. So we have 203 that are here right now. You will get to meet some of the graduates of the program later this session. We will have our foster youth intern program back this year, and we're very excited about that. Let's see, what else do I need to tell you? You know, I'm always telling you that we need more staff. So I want to be clear about what Carrie said about these 52 TO. That's not new people. That was people already working for us in job appointments that got converted to the table of organization. So don't think we got 52 new people, okay? Because I want us all on the same ground here. We didn't get new people. And when you think about what COVID looks like, and when I'm always trying to help you understand when I talk about the need for more staff in child welfare, in February, we had 960 child welfare staff. That's case carrying, frontline supervisors, people that are working frontline with clients. In February, I had 48 out on FMLA, 50 out on COVID, so they were either had COVID or were a close contact, and I had 106 vacant positions. And the reason we have the vacancies that we have in child welfare is because Walmart and Target and Costco pay $2 to $3 an hour more than we do, and you can work an 8-hour shift at Costco and get full benefits and go home at the end of the day and not be on call and not worry about how many children are in your caseload that might not sleep well tonight. For every vacant one of those positions, the staff that's there has to cover that caseload. I was in New Orleans, first time I got to go on the road a couple of weeks ago, and I met a supervisor who has 6 people that she supervises. She had 5 vacancies, and the one person she had was a staff that had been with her for 4 months. All of those cases, that was 60 cases in her supervision, probably more like 70 if she had told me the real truth, but should have been about 60, for her and a 6-month-old who can't carry a full caseload. So I am not coming to you asking for staff this year. This is a record. Don't be deceived. I will be back. I do want to talk very quickly about our partners. We have the Louisiana Fosters Partners, the First Ladies Initiative, and the nonprofits across the state that work to support our foster families. James Samaritan is over on the North Shore in the Covington area. They are the ones that partnered with us to get all those phones into foster youth hands right away, and then what they couldn't supply, we supplied the rest. I have pages of notes about foster agencies, but I won't do that to you today, but I have them if you want them. They were wonderful. We could not have done what they do to support foster parents peer-to-peer, because everybody that runs one of those programs is a foster or adoptive parent themselves, and so they've been in those shoes and they know the needs, and they're very, very responsive to our foster parents.
Madam Secretary,
Yes, sir.
if we could, I got the board kind of not lit up, but I
Okay.
have a bunch of questions.
All right.
But
You want me
I don't know
to
if there's if we could
stop?
kind of just move move quickly towards the end of your presentation. and
The only
take your time.
thing, the budget recommendations on the last page here, these are the things that are in the executive budget that we ask for, that we have received. So I won't go through them all. I just want to acknowledge and remind you that where it says we're getting TO, these are people already doing the work, and they are federally funded positions. This 14 to do the child support arrears unit, those will be new, but they are fully federally funded, so there's no state dollar tied to
I think
those.
we had that conversation last session about those being federally funded. So-
Yes, sir.
Okay.
And so the service delivery for Louisiana, normally we serve about 1 in 5, and this year we have served 1 in 3, and that is due to the needs of this state and the food response that we have had. So I will stop there.
Okay, let's ask Senator Abraham for a question.
Well, my first response is a wow. That was a good presentation. Y'all have done just a monumental work. That's all I can say. And I thank you for your passion and your compassion. It's very evident. And thank everyone in the department. Again, I've said this before, sometimes you have to hear this a number of times before it really kind of sinks in to really what's going on. And God, all the stuff, followed everything. It was just, it's remarkable. Anyway, thank you. I just have one simple question. On page 10, the budget says that under other charges for fiscal year 20 was 174 million, and on 20, and on 22 it was 246 million. Now you at the bottom of the page you break down what other charges are, but I guess my question is, that's about $75 million of extra other charges. So what were the extra other charges?
Senator Abraham, FY20 is the actual expenditures. When you look at 21 and 22, those are budgeted amounts, so they may not come in that high. They may be closer to the 174 than it is to the 246.
And I understand that is true. I mean, I'm not discounting that. But sometimes you put that in there because you believe you might reach that number. I'm guessing,
No, this information comes from the Division of Administration. This is the numbers that they put together for the recommended budget. If their analyst is here, they can speak as to why they believe that it might be that high. But
yeah, they would have to have some reason that they
Right.
added $75 million to budget authority. They would have to something.
It was not added. We
Okay.
had more budgeted in 20. It's just we didn't use all of it. No, we always have more budget authority than expenditures because I think we went over that last year. DDS, we have contract with physicians that determine disability. I'm sorry, Eric Horan, Undersecretary, before I forget. So, you know, we have contracts with this physician for DDS all over the state. We do not know really where the client's gonna go. It could be in New Orleans, it could be in Shreveport. We know we're not gonna realize the full contracts, but we have to be covered just in case. The same with some of our partners, especially these days with COVID. We don't know if they're gonna expend all their funds, you know? They may have 4 million of TANF for an initiative and not spend it. So we will never spend all our budget authority.
No, and I agree. I mean, maybe the question can't be answered, but all your other expenses are, you know, pretty much in line that you feel you're going to achieve. I understand it's a budget. I understand budget authority. I just thought it was a little strange.
Because the rest of the expenditure, like personal services, it's very easy to predict. We know what's going to hit in terms of payroll every 2 weeks. So we can be in the ballpark. Professional services, you see, we don't have many, and they're repetitive year after year. So these sort of things, we can be on the money. Overcharges, we have 300-something contract all over the place. We never really know where it's going to hit.
So in other words, the other charges at the bottom of the page, which make up other charges, you're saying that you don't know when those other charges could be enhanced and become a lot greater. And that's why you put it in the budget, I'm guessing.
Yeah, exactly. I mean, some years you're very close to the maximum amount of the contract, and over a year you may have 80%.
And I do see that you spend a lot less. I mean, on page 14, you know, you're 80%, you spend 80% of the budget, and I understand that. But I just thought maybe might have been some other reason why that was higher.
To your point, we had an increase a little bit because of the IT project that goes in overcharges, so light, you know, the integrated eligibility system, things like that. So there was some increase, but not to that extent.
Yeah. Okay, thank you.
Thank you, Senator Abraham. Senator Barrow for a question.
Thank you, Ms. Acting Chair. And let me just say, like I always say, thank you to your entire department for doing such a marvelous job during these very tumultuous times. I mean, you guys really have been drinking from a fire hose since last year, and we're praying that this year it's not, you know, we're hoping that we don't have a bad storm season.
Amen.
I'm definitely praying about that, because last year was just, you know, it was remarkable. We had never, that I can remember, entered into the whole new system of names, Greek names. Mm-hmm. Yeah. So I just want to say thank you, first of all, once again. Thank you to your staff. Please let them know that we appreciate their great work and their commitment. I guess my first question going to be to you is, you know, I'm trying to figure out how you're keeping the morale of these employees lifted with the amount of work that it appears, and you know, you say you're not asking us for any more job positions this year. But I'm trying to figure out how we're going to make that work. Because when you gave that scenario, I think you said in New Orleans or where, and I know it's a problem across the nation in terms of being able to hire people that will stay in these positions. But I just want to know how you keep it up the morale and how you plan to navigate through this.
Senator, thank you for that question. It is hard. The only answer I have for that is, and this is a two-edged sword, people that want to do this work and want to come into human services have a calling and a desire to truly help other people. Mm-hmm. And we're grateful for that. That does not mean that they should not be able to pay their own bills.
That's
and
right.
To take care of their own families. So just because you do good work doesn't mean you shouldn't be able to do well financially to take care of your own family. Our pay scale is out of whack, and we're gonna do a study with civil service and really look at that. We're doing everything we can to motivate staff, and we send messages. We have there's hard to do stuff by Zoom. People have enjoyed being able to work from home. They felt a little protected from that. We're just, I don't know. Maybe Dr. Hodnett has magic sauce that she's got that she's sprinkling on people to help them stay there. We call a lot. We reach out a lot. Supervisors are bending over backwards trying to stay connected to their staff and make sure that they're feeling appreciated and valued. It's been hard. We've lost 4 staff. In fact, we had the first death in our department of state employees. And that's hard when you have staff that are dying from this disease, but we mirror the population of our state. We're no different. And people are tired, and I will say this, they watch these hearings. They listen to you. So they hear your questions, they hear your compliments, and they hear your sincere appreciation of what we do, and things like what Senator Abraham just said with wow. They hear that. I'm always amazed when I get back from a hearing at how many email I have of staff that watch the hearing. So they do appreciate hearing that you value their work. It means a lot.
And that's important, and I'm glad to know that you guys will be working with civil service to develop an intentional way, a method of being able to raise the pay, because, to hear that they can make more money at Walmart or Costco and have benefits, we just have to do a better job. And when I look at the pay scale, it is very antiquated. I don't know the last time we really have purposely went in and really done some work to address this department. But you guys really, truly are the heart of state government. And if ever it was displayed was in this past year. I mean, just hearing your testimony about the workers who gave the man a cupcake. I mean, something so simple. And at 71, he had never had a birthday. There's so many things we take for granted.
Right.
And I don't want to become emotional, because this, for me, when I think about, how children and the ones that you guys are become responsible for, how they end up in the system, some of them no fault of their own. Sometimes they make the bad and poor decisions, but they have been through so much. And then you have workers who are stretched and beyond measure, trying to meet the needs, trying to get them all the services that they need. I just believe that we need to do so much more. And I'm glad that we are moving in the right direction. I can say, I believe I've seen this department come at least 10 to 100 miles from where it was 8 years ago. Or 6 years ago. So you guys are definitely moving in the right direction, but I think we still have a lot of work to do. And I'm glad that you're working with civil service. And on that note, how long are you guys looking to kind of try to put something together? Do you think we have something by next year?
Yes, ma'am.
Okay.
We definitely will by next year.
Okay. And then lastly, I do want to thank you guys for adding to the chart the demographics information. I really like the fact that you guys really drilled down, and not only did you do, in terms of race and ethnicity, just black and white, but you went further to do all the other ethnicities. I want to make sure I highlight that, and somebody else did that too, but I appreciate that. And I really appreciate you sharing the COVID numbers and letting us know how our children fared, as well as those families, those foster care families as well. And we're definitely sorry for the loss of those 3 foster parents that we lost in this process. But I just want to commend you guys again. I know you're not asking, but certainly if you would, I'd be certainly one of your biggest cheerleaders and fan, cheering you guys on. But I do want us to come up with a better methodology in terms of how people are being compensated for the hard work that they do every day. And they do it because they love the job.
Yes, ma'am. Thank you so much, Senator Barrow, and we will. We are really proud of the people that stick with this work, because it's hard work. It's just every part of it is hard, not just the child welfare part. The food stamp part is hard. We actually get more threats to employees from people calling about food stamps than we do about child abuse or child support.
Wow.
People will literally say on the phone, I cannot feed my child. I'm going to kill my child before I let them starve to death, and their death is going to be on you. We actually have de-escalation training for our staff to help be able to manage the phone calls that they get for food stamps. Because when people call us, they are so at their wits' end and the end of their rope. So there's no part of this agency that's easy.
Well, again, thank you, because that takes a lot, and the stress on their mental health
Yes.
is a lot as well. But again, I appreciate it, and I'm glad that you and the department, and the administration is working with you guys to really look at some system of how we definitely make it better, improve it, and then increase the rate of pay, because I think that is essential.
Thank you,
But again,
Senator.
thank you. Thank all of
Great.
you.
Thank you, Senator Barrow. Senator
you.
Boudreau.
Thank you, Senator Johns. Madam Secretary, let me be brief and say my congratulations to the heavy lifting. I mean, the presentation was very thorough, hit on a lot of things. I think a lot of people are not aware of during disasters, the role that you all play, especially with those with special needs and that whole special population group, which the partnership with the hotels and so many other things this year, all of the, I guess the mechanics were worked out, and it was a really a smooth transition. I'll say it's no coincidence that you come after juvenile justice in the budget process, and we heard the dollars that are spent on that end, and I think for the entire state, I mean, we either pay for it on the front end or we pay for it on the back end. And if we don't put dollars into these services that are provided, the options for those people are very, it's a very small window to start off with. And they end up in the juvenile justice system, where we know the cost for that is just almost prohibitive today. So thank you and your team for continuing to do it. We get to see a lot of you in health and welfare, where there are issues that everyday issues. Your outreach as it applies to foster care and to the adoption programs, even through COVID, which has been limited, the need is still there for more adoptions, for people to understand, those that are in the foster care business, the need for community support, for those fundraisers that have, not been able to be conducted, so that we can continue to improve that quality of life for these individuals. Because when they give up, it's either in the juvenile justice system or they're in the adult criminal system, and both of those we can't afford to keep paying at that rate. So thank you and your team for your leadership and for the hard work that you all continue to face every day.
Thank you, Senator.
Thank you, Senator Boudreau, and I think Senator White has a question.
No question. Just thanks for coming. I know y'all have had a thorough hearing, and thank you for coming. And we're fixing to hear natural resources. We got 3 units left to finish this afternoon.
All right.
So, if I could, Madam Chairman, I'll close this out. And despite everything that you went on, your adoption numbers were still phenomenal.
That's
and,
right,
and I
fourth
just,
highest record.
So we greatly appreciate putting those children in a permanent home, and we look forward to working with you during the session. And to all of y'all that are listening out there, thank all of you. So thank you, Madam
Oh,
Chairman.
so much.